Asterisk, you may be living with a dangerous enemy inside your body without even knowing it. That is fatty liver, a seemingly harmless disease that is silently destroying the health of millions of people around the world. No obvious pain, no fever, no easily recognizable initial signs, but every day, every hour, your liver, the second largest internal organ and the body's chemical factory, may be suffocating by the seemingly harmless eating habits and lifestyle that we maintain. According to the World Health Organization, 1 in 4 people are living with fatty liver, and most of them don't know it until it's too late. In today's video, we will expose 6 silent causes that make your liver degenerate every day. Discover 8 early warning signs that you absolutely should not ignore, and especially 5 golden secrets to help cleanse the liver, improve health from the inside. If you care about your longevity, physical strength and spirit, do not take your eyes off this video. Just watch it all. You will know exactly what you need to do to save your liver before it's too late. Main causes of fatty liver disease. Fatty liver, also known as fatty liver degeneration, is a condition in which the amount of fat accumulated in liver cells exceeds the normal level, usually more than 5% of the liver weight. It sounds simple, but if not detected and treated promptly, this condition can lead to serious complications such as hepatitis, cirrhosis, and even liver cancer. According to statistics from the World Health Organization, WHO, an estimated 25 to 30% of the global population suffers from fatty liver disease. And this number is alarmingly increasing, especially in developed and developing countries. So what has turned our liver into such an unwanted fat storehouse? To answer this question, we need to delve into the core causes. To better understand fatty liver disease, we need to identify the main factors that cause it. There are many causes, but below are the top culprits that you need to pay special attention to. Cause 1. Diet, the sweet killer of the liver. The modern diet, with the prevalence of processed foods, sugary drinks, and saturated fats, is one of the leading causes. Imagine, every time you enjoy a can of soda, a bag of fried snacks, or a cake filled with cream, your liver is working hard to process that huge amount of sugar and fat. Over time, the amount of fat that is not completely metabolized will accumulate, settling right in the liver, causing fatty liver. Real-life example. A recent study showed that people who regularly drink sugary soft drinks, at least 1 can a day, have a 50% higher risk of fatty liver than those who do not drink. The fructose in sweet drinks is the most worrisome factor because it is directly converted into fat by the liver. Cause 2. Omega-6 rich vegetable oils, a double-edged sword. Did you know that excessive consumption of omega-6 rich vegetable oils, such as palm oil, sunflower oil, cottonseed oil, and margarine, can also contribute to fatty liver? Although omega-6 is an essential fatty acid, when the ratio of omega-6 to omega-3 in the body is unbalanced, too much omega-6, it can promote inflammation in liver cells, causing disorders in fat metabolism. Expert advice: balance the ratio of omega-6 to omega-3 by adding more foods rich in omega-3, such as salmon, chia seeds, flax seeds, and extra virgin olive oil. Cause 3. Sedentary lifestyle, the thief of liver health in the age of technology. Sitting for long hours at work and not moving much has become a habit for many people. When the body does not burn enough calories, excess energy will be stored as fat, and the liver is one of their favorite destinations. Real story: Mr. Min, a 35-year-old office worker, spends 10 hours a day sitting in front of the computer and rarely exercises. After a while, he discovered that he had grade 2 fatty liver. After only 6 months of persistently exercising 30 minutes a day and changing his diet, his fatty liver condition improved significantly. This shows that exercise not only helps control weight, but also has a direct positive impact on liver health. Cause 4. Insulin, Resistance. A complex connection. Insulin resistance is a condition in which the body does not respond effectively to insulin, leading to high blood sugar levels and forcing the pancreas to produce more insulin. This condition is often associated with obesity and type 2 diabetes. When the body is resistant to insulin, the ability to regulate blood sugar is impaired, which also stimulates the liver to produce and store more fat. Notable data: about 70 to 80% of people with type 2 diabetes also have fatty liver disease. Good blood sugar control and improved insulin sensitivity are key to protecting the liver. Cause 5. Genetics and hormonal changes. Uncontrollable factors. Although lifestyle plays an important role, genetic factors can also make some people more susceptible to fatty liver. If your family has a history of liver disease, you should take the initiative to have regular liver health checks. In addition, hormonal changes, especially in women during pregnancy, acute fatty liver of pregnancy, or with diseases such as polycystic ovary syndrome, PCOS, can also cause fat imbalance in the liver. Cause 6. Alcohol, the notorious destroyer. It is impossible not to mention alcohol, the notorious destroyer of the liver. Consuming too much alcohol will cause the liver to work too hard to detoxify, leading to fat accumulation and causing alcoholic fatty liver. This is a particularly dangerous form of fatty liver and requires immediate medical intervention. The above causes have partly revealed the curtain on fatty liver disease. However, what is more worrying is that this disease often has no obvious symptoms in the early stages. So how can we recognize the SOS signals of the liver early? Let's go to the next part to discover 8 signs of fatty liver that you should not ignore. 8. Signs of fatty liver that you should not ignore. Fatty liver disease often progresses silently, without obvious symptoms in the early stages. However, as the disease progresses, the body will send out warning signals. Here are 8 hidden signs that you need to pay special attention to. Sign 1. Spider veins. Tiny blood vessels, like spider webs or stars on the skin, especially on the face, neck, chest, and arms, can be a sign of poor liver function. When the liver has problems, the ability to regulate blood circulation is affected, leading to dilation of the capillaries. Sign 2. Red palms, palmar erythema. If your palms are often unusually red, especially at the base of the thumb and little finger, it could be a sign of liver problems. This change is caused by increased blood flow and dilation of the small blood vessels in the hands due to liver dysfunction. Sign 3. Swollen abdomen or ascites. This is a sign of more advanced fatty liver disease. When the liver is damaged, it cannot regulate body fluids effectively, leading to a buildup of fluid in the abdominal cavity, causing swelling and discomfort. This is a condition that requires immediate medical attention. Sign 4. Varicose veins. In the abdomen, caput medusae. When the liver is severely impaired, blood cannot circulate normally through the liver, forcing it to find another path, causing the veins in the abdomen to dilate, creating an image similar to the head of a medusa snake. This is a dangerous warning sign, indicating that the liver has been severely damaged. Sign 5. Unexplained itchy skin. The liver plays an important role in the body's detoxification process. When the liver is overloaded with fat and toxins, these substances can accumulate in the skin, causing an uncomfortable itching sensation, sometimes accompanied by jaundice or yellowing of the skin or eyes. Sign 6. Right shoulder blade pain, although less common. A dull ache or discomfort in the area between the shoulder blades, especially on the right side, can be a sign of liver stress. The liver is located just below the right rib cage, and when it becomes swollen or inflamed, it can cause pain that radiates to this area. Sign 7. Dark skin patches, acanthosis nigricans, the appearance of dark, thick, velvety patches of skin in skin folds such as the neck, armpits, groin, or under the breasts is often closely related to insulin resistance. As mentioned, insulin resistance is a major risk factor for fatty liver. Sign 8. Changes in fingernails. Your fingernails can reflect the health of your liver. Signs such as pale nails, leukocyenia, horizontal lines on the nails, Murex lines, or deformed nails can be signs of liver dysfunction, as the liver plays an important role in absorbing and distributing nutrients to the body. Recognizing these signs early is extremely important for timely intervention. But after identifying the problem, what should we do to save our liver? Don't worry, because the liver is an organ with amazing resilience. Let's move on to the final part to learn 5 golden secrets to help you cleanse your liver effectively. 5 golden secrets to cleanse your liver. Once you recognize the signs, it is important that we take action. The good news is that fatty liver disease is a condition that can be significantly improved if you make scientific lifestyle changes. Here are 5 golden secrets to help you cleanse your liver and protect your overall health. Secret 1. Apply a healthy liver diet. This is the most important foundation. Make your diet a medicine for your liver. Increase green vegetables, fresh fruits, less sugar, whole grains, oats, brown rice, lean proteins, chicken breast, fish, tofu, and healthy fats, avocados, nuts, olive oil. Avoid processed foods, fast foods, fried foods, sweets, sugary drinks, red meat, and saturated fats. Tip: try the Mediterranean diet, which has been shown to be very good for liver and heart health. Tip 2: stay hydrated. Water is your liver's best friend. Water helps your body eliminate toxins, supports digestion and fat metabolism. Drink enough 2 to 2.5 liters of water per day, depending on your physical condition and activity level. You can also add liver-friendly drinks such as green tea, rich in antioxidants called catechins, which help protect the liver. Warm lemon water helps stimulate bile production, which aids in fat digestion. Tip 3. Make exercise a habit. Exercise is an essential medicine for reducing liver fat. Exercise helps burn calories, lose weight, and improve insulin sensitivity, all of which are extremely important for fatty liver. Goal: at least 150 minutes of moderate intensity exercise per week, for example, brisk walking, swimming, cycling, or 75 minutes of high-intensity exercise, for example, jogging, HIIT. Tip: find an activity you enjoy and stick with it long term. Invite a friend to exercise with you for extra motivation. Tip 4. Say no to alcohol or limit it as much as possible if you have fatty liver, especially alcoholic fatty liver. Stopping or cutting back on alcohol is a must. The liver has an incredible ability to regenerate, and eliminating alcohol will create the best conditions for the liver to recover. Tip 5. Consider liver-supporting foods and consult an expert. Some foods and supplements are said to help detoxify and protect the liver. Foods: garlic contains allicin. Turmeric contains curcumin. Beets, grapefruit, dark green leafy vegetables, spinach, kale, herbs. Supplements: milk thistle contains silymarin, which is known to protect liver cells. Dandelion helps increase bile production. Important note: while these foods and supplements may be of assistance, always consult your physician or nutritionist before adding any supplements. Add to your regimen, especially if you are taking medication or have any other health conditions. In short, listen to the voice of the liver. Understanding fatty liver disease from the causes to the warning signs is the first and most important step to protecting your health. The liver is an extremely important organ, performing hundreds of different functions to maintain life. Don't let it be overworked and damaged silently. If you notice any of the signs mentioned in this video, don't hesitate to see a doctor or medical professional for timely examination and advice. Liver health is your overall health. If you find this information useful, Don't forget to like this video, share it with people you care about, and subscribe to our channel so you don't miss out on other useful health knowledge. Thank you for watching. Let's take good care of our liver together. See you in the next video.